Welcome to our channel where we give tips for surviving motherhood and provide a place for honest conversations about women's mental health. We make new videos every Monday, every week. We hope you like our video and don't forget to subscribe below.
Today we're going to talk about the baby blues, what it is exactly, how long it lasts, and how it's different than postpartum depression, and when to be concerned that the baby blues might be something a little bit more that needs help. So Bina, what is the baby blues?
That is a good question. So the baby blues, they happen in about 80% of moms, so very, very common. And they involve things like feeling really sensitive, crying, feeling emotional, kind of feeling that up and down feeling that moms typically feel soon after having a baby. But overall, the mood is happy. They do feel like themselves. It can start right after birth, and it only lasts for a few days and at the most a couple of weeks.
So is the baby blues something to be worried about?
Well, no, the baby blues is not what we call a pmad, which is perinatal mood and anxiety disorder, which is kind of the umbrella term for what most people call postpartum depression. It is very normal and is actually sometimes called a non-disorder because it is normal. But what happens is many times people don't know how to tell when these feelings are the baby blues, or are these feelings and symptoms maybe signs of something more serious like postpartum depression. So Felicia, when should you be worried that it might be something more than the baby blues?
I think there's a couple signs that we can look for. If it's been going on for longer than 2 weeks, that's a good indicator that it's no longer the blues, because after 2 weeks, we're not talking about the baby blues anymore. They don't go on for years or months at a time. We also know that you're the best judge of character with how you're feeling. If you don't feel like yourself, things just don't feel normal, or maybe a loved one or friend keeps saying that something's off about you, that may be a sign that something bigger is happening. Also, if anything is happening to a more extreme level, like you're finding that you're crying all the time or most of the time, or most of your days feel sad or worthless or overwhelmed, if anything is kind of happening on a more majority level, it may not be the baby blues.
Absolutely. Those are really good points. I really think that piece, what you mentioned about that feeling like something is wrong and you're not yourself, is key. Because many times I know from the moms that I work with, that is a big red flag where they feel like, hey, something is not right. I'm not myself. Even if they can't quite describe it, I think that is a huge indicator and something to listen to. And what about psychosis? You know, we always hear about moms hurting themselves, hurting their babies, those really scary stories on the news. And that can make moms and families really afraid of what's going on and is that happening to them and what should they do? Can you tell us a little bit about postpartum psychosis?
Yeah, I think most often when people think about the baby blues or postpartum depression, they think psychosis, and that makes it seem even more scary. But in reality, only 1 out of 1,000 moms deal with psychosis. So the statistics are much smaller with that. It is a very serious matter that if you think that you're dealing with psychosis, you need to go to your local ER or call 911 and get help. It includes seeing and hearing things that aren't there, or having an intense desire to harm yourself or somebody else.
Okay, that's good to know. And I think that knowing that it's very rare, but also that it is an emergency, and it's also very treatable. So again, getting help quickly is really important and really key with postpartum psychosis. And so just to kind of wrap up what we've been talking about, when we talk about the baby blues is not postpartum depression. It is different because it does happen to so many moms. But the biggest factor is that the baby blues will resolve and get better on its own within 2 weeks. So if it's been longer than 2 weeks, we might be looking at postpartum depression or something else. And that with postpartum depression or one of the other perinatal mood and anxiety disorders, that does not typically go away on its own and will in fact get worse rather than getting better. So if you or someone you know and love is having some of these symptoms, ask them how they're feeling, and if it feels like it might be postpartum depression, then encourage them to reach out for help. Postpartum Support International has a warmline at 1-800-944-4773, and that is a great resource to get help. So leave us a comment below and tell us if you've ever experienced postpartum depression, but you were told it was just the baby blues. We'd love to hear from you.
That's all for today. Thanks for watching. Don't forget to like our video and subscribe. Bye.